Welcome, everyone. My name is Alessa Holler, and I'm a program analyst at Healthcare Ready. We greatly appreciate your participation today in Ariana Gordillo de Vivero's discussion on mental health, self-care, and burnout at free and charitable clinics. This is the fourth event of a series under the Restoring the Healthcare Workforce for Equity program. We want to make sure that this is valuable time for you, so this is how we plan to spend the next hour. After our brief opening remarks, we'll dive right into the webinar, followed by a Q&A session. A couple of housekeeping items before we begin. We'll be continuously looking at the chat, so please feel free to post any questions or comments throughout our time together. If you would like to make a verbal remark, please raise your hand because it'll let us know to call on you. The more that you post in the chat and contribute to today's discussion, the more beneficial we feel this conversation will be. And it will also help us to adjust and deliver recommendations that are most applicable to your experiences in healthcare settings. I'll now hand it over to my colleague, Angie M., Healthcare Ready's Associate Director of Programs and Policy.
Thanks, Alessa, and hello, everyone here. First of all, pat yourselves on the back for making time for yourselves to be on this call. It's a really important discussion. I'm so excited that you're here today and that we're here to be able to listen to and learn from Ariana today. For those of you who we haven't had a chance to meet yet, I'd love to take a moment to just briefly introduce Healthcare Ready and our work in health preparedness and response. Healthcare Ready is a nonprofit 501c3. We were founded in the wake of Hurricane Katrina, when in the years after the event, still were having problems accessing healthcare services, getting their prescription medication, and so forth. So from that event, Healthcare Ready was born. We serve as a linkage point between the public and private sectors to make sure that patients continue to have access to healthcare before, during, and after disasters. If you ever need us for a disaster, or if you ever needed someone to talk about to support emergency preparedness planning, feel free to reach out to us. We're at alerts@healthcareready.org. So today's discussion is brought to you through our program that Alessa mentioned, Restoring the Healthcare Workforce for Equity. It's funded by the Center for Disaster Philanthropy, and this is one of a few initiatives that we have that's specifically geared towards capacity building for health centers and clinics. This program, these webinars, they seek to really highlight the challenges that the healthcare workforce has experienced throughout the pandemic and in our current phase of navigating recovery. The webinars and the research that's being conducted here, we'll share an opportunity to provide feedback via survey momentarily. I have a special emphasis on providing support and resources for communities that have been hard hit by COVID-19. That includes communities of color, members of the healthcare workforce who are from communities of color themselves, and all frontline workers that serve patients in health centers and clinics across the country every day. We hope you'll stay connected and join us for future webinars and findings from our research on the healthcare workforce. I am super excited to introduce Ariana Gordillo de Vivero. Ariana is the Director of Strategic Initiatives at the National Association for Free and Charitable Clinics. As we go through these events with increasing frequency and severity, it's so important for us to address staff health and well-being. With that, I'm happy to pass it off to my colleague, Ariana.
Thank you so much. I really appreciate the introduction. So just to give a little bit of background about me, as they mentioned, my name is Ariana. I have been with the National Association of Free and Charitable Clinics since 2011, which means I'm celebrating my 12th anniversary here. The reason I share that is that that'll come into play in my presentation. I'll explain why. I was born in Peru, and I was raised in Florida and then moved to the Washington, D.C. area back in 2006. So I've been here a while, and at the NAFC, as many nonprofits that may be on the line know, I've worn a lot of hats. whether it was making sure that I communicated with all free and charitable clinics across the nation, which I still do. But now, for example, one of my major roles is negotiating, dealing with, starting, maintaining all of our national partnerships at the NAFC to better support the work of free and charitable clinics nationwide. And so one of the things that I've done, and I've actually presented on in the past with one of my clinic colleagues, is around the topic of mental health, self-care, burnout. And so when talking with Healthcare Ready, we thought this would be a great presentation to share with you all. And I share this information from experience from an organizational standpoint. I share this from the perspective of free and charitable clinics. And I think what's important to note about that is that I'm sharing that from the experience of organizations that are nonprofits that don't have necessarily huge budgets all the time, not every clinic, that have to find ways and are in the healthcare sector, which means that this is a very important topic to us. So I thought it'd be important to be able to share this to try and foment and grow our resilience. So, as I mentioned, let's see. One of the things before we get too in the weeds, I wanted to be able to provide you with a little bit of foundational information that I want us to deal with, because it's going to be connected all throughout the presentation. What is mental health? Now, according to the CDC, what it is it's all about mental health is this big umbrella term for our well-being, whether it's psychological, whether it's social, emotional, it's how we react to things, it's how we deal with other people. And I wanted to share with you all one item that I think just jumped out at me last year that I thought was so interesting, and it's so important to really explain, is that when looking at mental health, even though many times people use these words interchangeably, mental health and mental illness are not the same. We run into problems, I would say, when we use them interchangeably, because they're not the same. And this draws upon it a host of issues such as stigma and such. So, mental health is your well-being. So you can have good mental health, a period of good mental health, good well-being, while still having a mental illness. You can also be diagnosed with a mental illness, you can have not be in a good place mental health wise, and have a mental illness, and vice versa. So we need to understand that this is not the same. And this is important, like I mentioned, that because when we start changing those two terms around, there is a lot of opportunity for things like stigma for us to either think, if they're the same thing, that there's professional expectations, things like that. So we want to make sure that we separate those. You can, for example, have a mental illness. So, for example, I have generalized anxiety disorder, but my mental health is doing great right now. Not the same thing. So when looking at mental health, I think that one of the important things that I wanted to provide, especially from the free and charitable clinic perspective, but when we're talking about the healthcare sector, is how much mental health and social determinants of health not work together, but how they're connected, right? Many of us on the line know about social determinants of health. There's barriers that affect your health, whether it's access to education, whether it's access to healthcare, being in a safe neighborhood, transportation, having a community, a culture of a community, being part of community, or a sense of culture, economic stability. All of these things affect our health. What I'm trying to get to, and keep this in mind throughout the presentation, is that your physical health is just as important as your mental health. And when we're looking at mental health and social determinants of health, they, at the same time, this is not a chicken and an egg kind of comparison, at the same time, each affects the other. If you have, you're economically unstable, or if you, don't have access to healthcare, if you are not in a good neighborhood and you have safety worries, that's going to affect your mental health. And so they affect each other constantly. And I think that when you look at social determinants of health, you can see how a lot of these, especially if you're looking at Healthy People 2030, for example, that a lot of us look at as objectives and goals, how they're interlaced. Now, this is an infographic that I think many of you were more used to seeing about social determinants of health. So I think it shows very well before they updated that, I think in the past year or two. You can see that it's all connected. Each affects each other. If you don't have housing, that it will affect your mental health. If you don't have a support system, if you have children and there's no playgrounds, access to playgrounds, for example, all of this can affect your mental health, and vice versa. Not having those things or having those barriers can do the opposite. So these are all connected. And I say this so that I can really drive the point home of the fact that physical health is just as important, and we have to treat it the same as mental health. So now that we've kind of established a couple of big topic definitions and such, I kind of want to take the pulse of those of us that are together on this presentation today. We're going to put out just a couple of polls, or I believe it's 3 polls. And I want you to really think about the last 3 years. I mean, we've all gone through a lot in the past 3 years. So thinking about those 3 years, because COVID-19 is a big part of what we've all been through, obviously. The first question is, and this is anonymous, so please, this is a safe space. Have you had COVID in the past 3 years? The second question is, have you experienced a COVID death in the past 3 years? What this means is, do you know somebody who passed away because of COVID after having COVID? And the third question is, thinking back to the past 3 years, so since 2020, have you worried about your organization staying open? And this might be a question that is more for if you are in a leadership position at your organization, but I'm very curious as to how we all think, or our answers to these questions, just because if we think about the last 3 years and the pandemic, it's important to understand that you're not alone. I think we'll give it just another second or two. Okay. All right. Just to share with you, and for the first question, have you had COVID yourself? And of course, my vote's not in there, but I have to. So this is probably more than 80% of you online have had COVID at some point in the past 3 years. The second question, whether you've experienced a COVID death in the past 3 years. Over 60% of you have experienced that. That's a huge number. It's a giant number, in my opinion, that this has affected so many of us. And in the past 3 years, over 48% of you say that you have worried about your organization staying open. That's a large chunk of the audience. I think it's important to note, thank you so much for helping me with the polls, that you are not alone. There are large portions of this country and of the world that have experienced major traumas in the past 3 years. And just to show you, some people are more visual. I definitely am. I pulled this a few weeks ago, so I know that I checked this morning and the numbers actually have gone up. But according to the CDC, I was looking at the number of total deaths per 100,000 people just in the United States, as reported to the CDC. And for those of you who are looking at your screen at this presentation, there are over 1.1 million. This is since the start of COVID, 2020. 1.1 million people have died in this country. That is about 284 people for every 100,000 have perished. And there's also a map that shows kind of where more deaths have occurred according to what part of the country you're in. You're not alone. I want to share that because I think that for many of us, the past 3 years, there were times there where that we felt extremely alone. And because we've had almost this shared trauma or shared past 3 years, because I'm not really sure that we're completely out of it yet, I think that that calls for this importance of looking at our own mental health care, because during the past 3 years, and I know many of you, those of you that are in the healthcare sector, and you don't have to be a healthcare provider for that, so please don't hear that. We've been having to focus on how to help others, right? This is now we have to make sure that we are also helping ourselves to help others. So we have to look inward. We have to look at mental health and us. Now, as I mentioned, I am doing this presentation from the perspective of free and charitable clinics right now. And I wanted to show you also that so that we could take a look first at this part of the sector. So when I was looking at free and charitable clinics nationwide and mental health in general, just the topic, I was like, okay, what are we doing? And for information, this is as updated as end of 2022. So we got this information January, February 2023. So this is pretty updated. 64% of clinics provide mental health as a service. Great. 42% of clinics provide social services. 45% provide tobacco cessation counseling. And 27% of clinics have participated at the local or state level in coalitions or groups that focus on mental health back in 2022, last year. These are just some stats that I pulled that I thought were interesting. So clearly, okay, as much as obviously for me, the ideal is one day like 100%, right? But clearly our clinics, just to provide you with that perspective, we are looking at mental health. Mental health is important for our patients. Absolutely. Great. We're working on this. But what about for ourselves? There are questions that I want you, and this is not a poll question or anything like that, but I really want you to think about for yourself, for your organization. Where is your own mental health on the organization's list of priorities? Does it reach the top of the list? Is it anywhere near the top? Is it just, oh, that'd be nice, cool, you know, for the organization, mental health? Is it a nice to have or is it a must have? I would bet that many of you, it might fall more into the nice to have than a must have. And before working for the past 12 years at the NAFC, I would say that the answer I would have come up with beforehand would have been something closer to, well, you know, keeping the door open is more important, or like hitting that sales goal is more important. You know, mental health is more mushy stuff. I wouldn't have thought about it. So I want you to really think inward. Where is it for your organization? And be honest with yourself. Mental health care, unfortunately, in the healthcare workforce, and this is not just, I hope that those of you who are not providers yourselves don't think that we're talking about just providers. It's providers, it's administrative, it's everyone from the front desk greeter to the executive director. We are already at a disadvantage. I'm not going to lie. Why? Because in this sector of healthcare, when you're providing healthcare, you are already more likely to experience mental health problems. So we're already starting about a foot behind. This has to do, and I'm preaching to the choir here, but this has to do with labor shortages, which I know have been going on. This has to do with being exposed to that human suffering every day. I don't understand how clinics do it. I really, really don't. It's financial strain. It's the fact that you take it home with you, and I have not learned how to not take it home with me 100% just yet. It's the stigma. I know for a lot, at least I can only speak from the perspective of a lot of our free and charitable clinics. It's the fact that most of them place their patients' well-being first before their own. That makes it much more likely for you to experience mental health issues. Now, I'm sharing this because I thought it was hysterical, but you could clearly see, funny story, mental health and our well-being in COVID-19, especially in the past 3 years. As many of you may have, we reduced the amount of in-person, person-to-person meetings and such. And I don't even know how long I didn't have, one of my major roles is partnerships, right? I didn't have a meeting definitely for a long time. My first meeting, as you may be able to see on the left side of your screen, with one of our partners, BD. We were so happy. First time I've met someone for work in like 2 years, probably. We both got COVID the next day. I mean, or maybe the next 2 days. It was awful. And on top of that, we were both really going through burnout. So you can tell the difference. Nobody needs to see that version of us on the right, like ever. That does not even look good. I'm pretty sure somehow I lost my tan on top of it. Like, it was bad. So this is more just self-deprecating humor, but it can affect all of us. And burnout is one of the things that I wanted to bring into the conversation as well. It can affect all of us. Like I said, from the front desk greeter to the provider, to the psychologist, to the administrative department head, to the executive director. And we have to be on the lookout for these symptoms. I pulled a set of questions that I thought were really, really cool to read through, and please read through them for your own self. I am embarrassed to say that there have been many moments where my answer to these, for too many of these, was yes. And I almost felt, I don't know about if any of you are on social media, but I was like, man, I feel attacked, like personally attacked here. Why would they ask these questions? These are symptoms of burnout. These are questions and things that you can look up very easily. They're online, and ask yourself, or ask, your colleagues to ask themselves. They're things that you want to look out for, because with burnout comes a lot of consequences, whether it's performance, whether it's loss of staff, turnover. It's important to be able to recognize what burnout is, especially amongst your employees. Now, I'm not going to go through all of these, but I thought it was really important to go through just a handful of them. There's a lot of barriers that we all have, and in any sector, frankly, to our own mental health. And I'm not even going to go into our individual mental health, because I think that's a whole different layer with a whole different presentation of barriers we put on ourselves. But as an organization, there are a number of barriers or walls that we run into to be able to provide and promote mental health and self-care. And for some of these, I just want to mention, I had done this presentation with a former colleague, or one of my board members actually, who runs a clinic, to be able to write the clinic and the NAFC perspective at the same time. So some of these examples I'll give are at the clinic level. So one of these barriers, and I know, thank you all so much for the comments that you provided in the pre-presentation survey. That was incredibly helpful, and really showed me that we're on the right track. One of them is just, it's financial. Mental health costs, it costs too much. I'm not going to lie. If you told me like 5 years ago, yeah, how's your self-care and your mental health care? The first thing I'm thinking about, I'm just going to be honest with you, is, oh, I would love to go to a spa. One of those like retreat places that cost like $10,000, and they take away your phone and all you do is relax for a week. I would love that. That's what self-care like kind of looked to me. I don't have $10,000 to go to a spa retreat, so we'll have to figure out other ways. But I think many of us kind of start immediately thinking that it's a financial thing when it is not and doesn't have to be. There are a number of ways in which you can tackle mental health, self-care at your organizational level that have little to no financial cost to you. And I'm sharing some examples from my clinic colleague and board member. So for example, you could have, she was telling us about having a potluck with their staff, with their volunteers, where everybody brings in a dish from their culture or something that they really like to make, and we're able to share with each other and understand where everyone was from. That costs nothing. I'm pretty sure my colleague said, oh yeah, I think we had to buy like one of those plastic tablecloths and maybe print out some flags. That's about it. So that doesn't cost anything. It's making that connection, right? In order to mitigate burnout and really focus on self-care. It's things like, one of the other examples that she provided was they did this gratitude garden where they had almost like an art project afternoon where they painted rocks and put sayings that they wanted to say to each other. And that's, I'm pretty sure they got rocks literally from just outside the clinic. So I don't think that costs much either, except maybe some paint. But it's a team bonding. It's a team exercise. It's making fun of the fact that I don't think I can paint. But it's all of these things really promote self-care, and they promote connecting, because that is a big part of mental health, being connect with other people. Another one of the examples that are really great, my clinic colleague was telling the group that, they bought essential oils that they had in an area at the clinic, and they would pass around and gave people, and they're not that expensive, but they promoted and had spaces where people could, do breathing exercises, and it smells good, and it promotes some meditation and such. And that's a cool thing. Like, okay, great. And that's not expensive. And another example that I thought was great, and this kind of goes along with some other parts of this presentation, but one thing that they did was they had their board support their staff, and they had a board member who you may see on the upper right-hand corner of the slide. And I wish I had the video embedded, but who's a very funny board member from everything I saw in the video. But they just recorded themselves sending a message to the staff, sending a message of, you matter. We are so thankful for what you do for the clinic, for the community. And something as simple as that, that doesn't cost anything. If you have a board member who is like more extroverted, could do something like that, or just sending a little message, that's easy. These are easy ways to mitigate burnout. Now, a second barrier that we encounter is mental health education and where to start. This is a big one. Okay, great. I know that this is a big deal. Where do I go from here? And one of the things that I've definitely seen is to do check-ins. And this can be an internal policy as well, to say, okay, we're going to check in once a month at least, or bi-weekly. And this check-in, I really like this example because it at least starts to create a safe space in your organization. You don't have to go into the reasons of why you're having a crappy day. No, but what they instituted in this one was, it's just colors for how you feel. And it's a very quick, hey, Alessa, how do you feel today? What color? Yellow, how are you? And it was just easy. It's an easy way to just check in and see how your team is doing. That can lead to further conversation, but it also normalizes the fact that not everyone's going to be green every day. I have more orange days sometimes. Like, it's completely normal. And that normalization of getting that mental health education, that's important to start somewhere. Check-ins are very, very easy to do. And it just starts normalizing the conversation, which I think is essential. Now, this is a big one for me. One of the items that I've run into, and I've run into with a lot of different leaders, is this need to be strong for your team. People depend on me. If you are in a leadership position, you may have felt this way at one point or another. And just to share with you a very, very personal story, it's all about leadership, right? It's, I need to be strong for them. I need to lead them. I can't show weakness, which again, is sometimes, there are a million factors, whether it's cultural, professional. Sometimes people see, showing emotion or anything like that as a weakness. And that couldn't be further from the truth, in my opinion. So back in, I want to say it was 2021, or it might have been toward the end of 2020, I was going home from work and I got a call on my cell phone from one of my friends, but one of my board members. And I thought, oh my gosh, why is a board member calling me? Like, that's weird. Okay, got to pick it up. I wonder what's going on. And for those of you who are online, you can see, I have a picture of my friend Gigi, who was on our board. She called me and I thought, okay, what's going on? And I ended up being on the phone with her for, I think, over an hour, but she broke down completely on the phone with me. She runs a clinic in Miami, Florida, which is where I'm from. And that day she called me maybe an hour or two after the second staff member of theirs or volunteers of theirs, maybe it was a volunteer, had passed away that day from COVID. She was a mess. And she, you know, as the leader of the clinic, was trying to figure out, how do we get PPE? How do I do this? And now 2 people close to me just passed away. And she was in tears. And I mean, I had a couple of thoughts that came to me of like, first of all, wow, you called me. I'm honored. I didn't think we were that close, but I'm honored. But 2, why are you calling me? That's weird. And I asked her, like, why do you have people, you know, on your team that you can lean on, that you can also talk about all of these barriers and hoops you're having to jump as a healthcare worker? And she was like, no, I can't show emotion in front of my team. I need to be strong for them. And she literally said, I need to be strong for my team. I have to be a leader. And I mean, we had kind of a come to Jesus moment where I was like, look, you asked for my opinion. I could not be more against that. I couldn't. I'm on the other side of the spectrum. Like, no, you don't need to go cry in front of your team members unless you feel like you need to. You don't need to do that. But if you're not addressing the fact that you're all going through something right now, then you are not validating their feelings. And inadvertently, what you may be telling your team members is that nothing affects you and it shouldn't affect them either. You might be giving the wrong message. You don't need to cry. You don't need to, you know, be angry. You don't need to throw anything, but addressing the fact that you're going through something, whether it's something personal or something that we're all going through, like COVID, it helps validate that you're all in it together. And that, in my opinion, is a very strong leader. Again, we all have different management styles and such, but I really believe that if a leader shows you and validates things that are going on, especially when there's something like a pandemic, it shows much more strength than not. After this, just a quick happy ending, you know, I spoke to her after, and she actually instituted a lot of changes at her organization to be able to stop this whole mentality of, no, I have to be a leader, I have to be perfect, I have to be strong and stoic. She instituted different policies like, this sounds silly, but it's a thing if you think about it. Forced, you have to go take your lunch break. You cannot have lunch in front of your computer and be looking at your inbox as it keeps, you know, making sounds. Things like there are going to be spaces at the clinic or a space where you can go and relax and take a breath and take a short break, something, right? She actually instituted certain policies to make sure she shared education on mental health and burnout and such with her team. And they now check in and talk about it. And these things, I mean, I'm not gonna lie, I've seen a total 180 with her and with team members. It's helped them a ton. So just kind of getting out of that whole, I have to take the entire burden for my team, helped the team get stronger together. Now, one of the things that came up and is leadership pushback. What if your board doesn't believe that this is a priority? What if your board says, it's kind of mushy stuff, self-care, all of that. I don't know about that. That happens. I get it. I'm extremely lucky that our board is very supportive, but if your board, I think there's two parts to this that are important. If your board is not supportive of the importance of mental health, as important as it is, as physical health is, I would say that there's two things you can do. One, there's education missing. There is training that your board needs, not just your team, not just your volunteers, but your board needs to be educated on the importance. And then two, if I'm removing all of the more human aspects of why mental health is important, okay, you don't care about that, that's fine. There's personalities and personalities, but if you don't care about that, that's great. Let's just look at the economics. When you have staff burnout and you have people with not good mental health at your organization, it is going to cost you, and it is costing you a lot more when you lose staff, when your turnover rate increases. And it also costs you in the performance of your organization. You may think you're doing great, but I'm going to call you out on that. You're not giving 100% of yourself. You are not yourself that is in a good well-being, in a place of mental health. So that's going to cost, and we can go down to dollars and cents and how much it costs to train new employees, how much cost time that somebody else has to wear that hat because they left. Burnout is a serious issue. So if your board doesn't understand, or you doesn't have the training, or isn't accepting and there's free education out there and trainings out there, then come at it from an economic standpoint. It's going to cost you way more. We've seen it happen. And honestly, you could probably get down to the actual figures of how much it's going to cost you to continue not prioritizing mental health inward. Now, two examples of importance of that leadership support and why it's so important. And I was given authority to share this with you, but back when there was the murder of George Floyd, the NAFC, we decided, and our board was supportive of us, to put out a statement about the event. I won't get into too many details, but because of that, it put us on the map to some not so great groups out there, politically leaning groups that started sending us death threats. They very much, to the team, there were a lot of notes left and social media accounts hacked and such, but they focused very much on our CEO, our president and CEO, Nicole. They, put out her home address and everything. It got really, and she continues to deal with it, but it got really, really nasty. If it weren't for the fact that our board supported her and supported our team too, because of what we had to witness her go through for the past 3 years or 2 years, maybe, it was perfectly acceptable to have people say, I don't want any part of this. I want to leave this organization. If it weren't for board members, and they didn't have to pay for anything. It was board members sending a text. It was board members sending an email saying, hey, how are you holding up? It was board members. One time, I think we got like a care package from some of our board members with like chocolates and stuff. It was board members really caring about you as a person and not just as XYZ position at the organization. That kind of support is what you need to keep going. And the other just quick story about that I wanted to share is that back in the day, and I shared this, I since about 2008, I've had general anxiety disorder, and I used to have terrible panic attacks where it got, I think the word psychosomatic, but it got physical. You could even see it on me. And one day I was having a total panic attack. And I don't even know why. In my office, I closed my door. For some reason, my boss, Nicole, on the picture on the screen, she knocked on my door and I didn't even want to open But it got to a point, she knew something was wrong and was checking in on me. I finally opened the door and I was like, I can't breathe. I'm crying. And I was like, oh man, I guess my boss is going to have to see me not in a bad, vulnerable place. Okay, whatever. Like, we'll go from here. She gave me a hug and she didn't let go for a while. And then what she did was she said, okay, I'm going to do something. I've had experience with people with anxiety before. I need you to just repeat after me. And she said, let's count together. And she counted out of order numbers, just random numbers. And it was just one of these tips or tricks that actually calmed me and took me off of that ledge of anxiety. And I could finally felt like I could breathe because of something like this, because of a leader that said, your health, your mental health is more important than whatever you're supposed to be doing right now. Like she said, okay, we're going to take a break for a second. Because of that interaction and that, in my opinion, intervention, I chose to get help. I chose to get therapy. I chose to, I found medication that worked for me. And since then, I, again, have made a total 180 in my life and how I think. I'm better able to focus. I can think clearly. And that leadership support is incredibly important. And I know that not everyone has the ability to do this, but I will say my mental health is so important to my boss that I have therapy, virtual therapy every other Tuesday at 4:00. And she knows I'm like, I just work, I schedule meetings and stuff around that time. But if I'm at the office, I will close my door and do my therapy. Like, that is important. I can make up for that hour at another time in my position, of course. It might not be with other positions, but it's that important. And because of that leadership support, I've been here for 12 years. And I don't know about leaving, friends, because honestly, I can't even imagine another workplace culture where they take your well-being to such an important place. And then I'm going to go very quickly because I know I'm running out of time, but I understand that there's a barrier of being overwhelmed already. You guys are trying to juggle so many things and so many demands, but this has to be a priority. You may have to take a quick half a step back on something else to be able to make this a priority, because as I mentioned before, burnout, bad mental health at your organization level will result in bigger consequences that are going to cost you way more than what you're dealing with now. And then the other one that I want to make sure just we keep in mind is that there's also everyday bias that a lot of people think that they don't deal with. So when you're thinking about your team, you're thinking about your employees, not only are they dealing with everything we've talked about today, but there's also biases that people are dealing with that are just part of society, that are part of systems, that they're already coming down, that are weighing down on them, that they have to address and they have to deal with every single day. I'm not going to go through these biases, but it's something to keep in mind because they're already dealing with all of these things. But I believe that the moment you have awareness, the moment you say these things are real, it validates the fact that you can now be more aware of how they affect your own mental health. So that is a barrier, and it's something that we need to, there's a lot of education on this available. Now, last but not least, I just wanted to share, there's a lot of things that we can do. And I know that we got some questions about policies and such, but as I mentioned, connecting with peers is incredibly important. And not all of these have to be financial. And hey, if you are able to put in a line item, like we have a very small line item, it's not big, but we're able to do it for self-care. So that if I need, we decide let's do an app for mental health, we might be able to do that. So apart from financial things, though, there's also anything about connecting with peers. You can start curbing any sort of burnout or bad mental health or lack of mental health at your organization. It's policies such as making that lunch requirement where you have to go to lunch. Stop skipping lunch, people. It's policies like giving your employees the ability to have, just like there's PTO, if you need to take a mental health day, but have it in writing, right? It's policies such as check-ins or almost like internal reviews. The moment you put it on paper, it's different. It's not just this crazy idea that Ariana had the other day that we all should check in. Once you put it on paper and make it an internal policy, it's real. And it means that the leadership thinks that it is important. You can also I know that this is not necessarily possible for certain positions, but if you have like more administrative positions, being flexible in your scheduling. So if there is a position that can do some remote work, provide them with that flexibility, because that might really help them with their mental health as well. You can also do check-ins with things like the Maslow burnout scale, just a set of questions where you can see kind of where everybody is on that burnout level, right? There you can institute mindfulness breaks. You can and encourage them, not to say, okay, here's this thing that we're going to institute, and not do them yourself. You can model those healthy behaviors, because guess what? If your leader's not doing it, my first thought is, oh, if they don't need it, then I shouldn't either. You want to be like your leader, right? Internally, sometimes or subconsciously, that's what happens. You can designate meditation or like some sort of break space or room. Create a safe space for conversation. You can also, one of the things that I want to share, you can set schedules like, and I don't know, it depends on the organization, right? But like after this hour, between this hour and this hour, we do not want emails going out at 10 o'clock at night. That could be a thing. Or like there are certain days of the week. There's a day of the week where the best you can, you do not set any meetings, because that is your busy work day. That's the day for you to be able to focus a little bit more on all of the things that, we all know that we kind of end up adding to the list. You can support your team. You can prioritize you. This is going to sound crazy, but I know that at least one of you is going to laugh internally at this, because I did when I heard a speaker a few years ago. Go to the bathroom. Stop skipping going to the bathroom or skipping lunch. That is nothing to be proud of. I thought I was proud for a second, like, oh, I haven't even eaten yet today. That is not cool. There's nothing to be proud of. Stop thinking that. You're wrong. Have a balance. You need that. Be flexible, socialize, share a meal with one of your colleagues, or have a shared meal with your entire team when you can. Share education that's out there. There's so much out there. You type in mental health on Google and you'll get a plethora of resources. And make sure that you're assessing, that you're really looking inward, because making sure that you have a good, safe workspace that you have when promoting mental health is incredibly important. And it's going to keep, it kept somebody like me at a nonprofit for 12 years. I'm sure I could make more in the private sector, but it's basically the one or number two reason that I'm at the NAFC. It's not only do I love the mission, but it's because I'm at a workplace where I know that my team values me as a person so much. And I know how important I am to the team, and my mental health care is to the team. That's important. I don't know if I can get that elsewhere, right? So these are little things that we can do, and attend that webinar. Don't skip it because, oh, I'm writing this email, I'm on a roll. Attend that webinar, read through, skim that information, but there's so much out there. Get that training. There's free trainings. There's also expensive ones if you really want to go toward that. So yeah, there's a lot out there. So with that, I apologize. I know I went quite over, but if there are any questions or anything, I'm here. But yeah, we also have a number of different resources on mental health, self-care, and burnout, but I'm happy to answer any questions you all may have.
Yeah, thank you, Ariana. First off, for really sharing, your personal experiences with so much candor. I really loved how you use that to frame that mental health is essential to the field, and that we can look to leaders to be advocates, and can also advocate ourselves. There was a comment in the chat from Frank Johnson about mental health first aid course. That's a great resources for staff. Frank, if you'd like to come off mute and to kind of talk a little bit why this resource is beneficial and where it can be found, that'd be great. If not, I also invite Ariana, if you have any other resources or if you know of this course, to share any thoughts.
I'm not gonna. I could just mention that that's here in Mississippi. We utilize that for both youth and for adults. So it's very practical, very realistic with it, just like you get a first aid course CPR. So same principles they're in that training course. So it's in Mississippi. I'm not sure it's more than here, but we do that here for both schools and for other organizations. I'm with the Department of Mental Health in Mississippi.
Thank you so much. That's incredible. And we've had different mental health first aid courses I know are provided through a number of organizations. And like yours at the Department of Health, I think that's one that if you can Google in whatever your home state is or your area, there is very possibly an organization nearby who can provide that. That's an incredible course. And I've heard great things. I haven't taken it myself just yet, but I've heard that it's really, really good course to be able to take. Let's see.
All right, would anyone else like to come off mute to ask Ariana a question?
And it's okay if there's not any question. I just, I speak from experience and what I've seen and what I've learned at different clinics. And I will say that people are creative about how to address mental health care and self-care in the workplace. And again, you don't have to, and if you have the funding, great, if there are boards that can, or organizations that can put their money where their mouth is, I think that's fantastic. But it doesn't also have to be that, right? You can do little things like a potluck with your team, or you can do little things like even just sharing educational research. Like, hey, I saw this article the other day, and just sharing that. You can, I will say I'm very open about the self-deprecating humor, or being like, oh my gosh, I had the worst anxiety yesterday. I'm very open about that. Not everybody is, but if you have a team member that is happy to do that and kind of normalize the information and the education and the topic of, hey, I'm having a rough day, or this is my experience, have that person kind of be your leader, or have them start the conversation, but just start it. It'll help more than you know, and probably in ways that you won't even know. Let's see. I appreciate the kind comments. Willard, do you have some programs for youth and mental health and develop healthy coping skills? I will say, I believe we may have some sources on that. From our organization, our patients are generally 18 to 64, but I do have a lot of clinics that see the youth. We could definitely look into that for you, but I do know that they are most definitely out there. I could definitely get back to you, Frank. Thank you.
Well, on the note of thank you, Ariana, a huge thank you from behalf of Healthcare Ready for being here with us today. And thank you everyone in the audience for attending. A couple of closing thoughts before we end today's session is we'd love to have you join an upcoming webinar under the program on October 3rd at 3 p.m. Eastern Standard Time. It'll be a virtual discussion with Dr. Anil Prim on the impact of racism on mental health and well-being of healthcare workers. So in that session, tangible ideas and strategies will be addressed to respond to racial trauma. So we just dropped the registration link in the chat and hope you all can join. Moreover, as part of this program, we are conducting 20 to 30-minute interviews with community health centers, free and charitable clinics, and federally qualified health centers to understand how the healthcare workforce was impacted by the pandemic. These interviews are intended to amplify voices like yours, to inform solutions and resources to improve the healthcare worker experience. To find out more about this initiative or to participate, please reach out to research@healthcareready.org or give us a call at 202-240-1803. Alternatively, we are also just dropped a quick survey in the chat where you can share opinions that way. And on the topic of surveys and wanting to hear your valuable thoughts, Please complete the post-webinar survey. We just dropped in the chat as well. Your feedback will help us inform the success of this program. With that, thank you everyone for being here. We hope you have an amazing rest of your week. Thank you very much.
Thank you.